prompt response implemented to address high hospital referral rate. Vaccine rollout intensified as Malaysia receives 1 million Pfizer doses. Welcome to News at 10 with me, Brendan Lepol. The current usage of patient beds, including repurposed beds in hospitals in the Klang Valley, has now reached more than 85%. Health Minister Dr. Adam Baba said by taking into account the need for extra beds, especially in the ICU, the Health Ministry MOH would implement several immediate measures to address the unexpected high referral rate to the ministry's hospitals in the Klang Valley. He said MOH had already held discussion with Kuala Lumpur Hospital HKL, Putrajaya and Kuala Lumpur Federal Territory Health Department, Selangor Health Department and heads of expertise to come up with immediate resolution to solve this issue.
Antara langkah afirmatif yang akan dilaksanakan segera adalah seperti berikut. Pertama, memperluaskan lagi penyumber luaran ataupun outsourcing pesakit bukan COVID-19 ke hospital swasta bagi membolehkan Hospital Kuala Lumpur menerima dan merawat lebih ramai pesakit COVID-19. Kedua, meningkatkan kapasiti katil ICU dan bukan ICU termasuk peralatan dan kemudahan yang diperlukan seperti alat bantuan pernafasan di Hospital KKM dan hospital pengajar universiti seperti Hospital Pakar Kanak-Kanak UKM, Hospital Universiti Putera Malaysia dan Hospital Universiti Teknologi Mara bagi menerima dan merawat lebih ramai pesakit COVID-19.
Meanwhile, Dr. Adam said, of the total COVID-19 cases handled by HKL, 71% of the patients were in categories 3, 4 and 5, and others were in categories 1 and 2. Based on the latest record, the HKL Emergency and Trauma Department receives between 60 to 70 COVID-19 patients daily, with an average of 3 category 4 and 5 patients who need respiratory assistance in addition to needing to be treated in the ICU. Now, for the 6th consecutive day, Malaysia daily COVID-19 infections stayed above 6,000 mark, with 6,045 new infections registered today. Now, the number has brought the cumulative COVID-19 cases reported in the country since last year to 778,652. Selangor saw 2,262 infections in the last 24 hours, followed by Kuala Lumpur 616 and Negeri Sembilan 531. Meanwhile, Perlis recorded 0 new cases. 5,271 patients have made full recovery from the virus, bringing country's recovery rate to 90.6%. As of this afternoon, there are 67,669 active cases in Malaysia, with 917 are being treated in the ICU and 443 of them requiring ventilator support. Today also saw a significant drop in number of death cases, with 63 fatalities reported, taking the country's death toll to 5,497. 17 new clusters were identified in the last 24 hours, 11 of which were workplace related. Two low-risk COVID-19 quarantine and treatment centres, PKRC in Kelantan, are expected to close by the end of this month, following the drop of daily COVID-19 cases in the state. State PKRC Director Dr. Muhammad Zurairi Muhammad Zubay said the involved PKRCs are Dewan Jubilee Perak and Malaysian Health Ministry Training Institute in Kota Baru. Dr. Muhammad Zurairi said there are 646 patients receiving treatment at 10 PKRCs in Kelantan, and the bed's usage has dropped to 50% compared to maximum usage previously.
Akan memaksimumkan sebanyak 5 PKRC di Kota Baru dan 3 PKRC di luar daripada Kota Baru. Jadi insya-Allah untuk kita menghadapi sebarang kemungkinan, kita melihat dalam lingkungan 8 PKRC ini buat masa ini insya-Allah mencukupi. 1/8 ni 2 lagi akan tutup. Ya, jadi akan tinggal 8. Tapi itulah, kita pun nak main tutup pun tak boleh juga sebab kita mesti bersedia.
Explaining further, Dr. Muhammad Zurairi said closure of the PKRCs was made possible with the help of the rakyat who have been complying to the stipulated SOP in effort to curb the spread of the deadly virus. Kelantan Police will continue to maintain 44 roadblocks throughout the state despite moving into Phase 2 of the National Recovery Plan, PPN, which begins tomorrow. Now, State Deputy Police Chief SAC Abdullah Muhammad Pia said, as free movement activities were still not allowed, some regulations related to some activities have been relaxed. He said the police hope the public will continue to adhere to the Standard Operating Procedures SOP, otherwise the authorities will not hesitate to take stern action.
Cuma beberapa aktiviti lah yang dibenarkan, seperti kedai makan boleh pukul 10, aktiviti riadah yang tidak menyebabkan bersentuhan, dan untuk bawa keluarga yang sakit dalam 3 orang itu antaranya lah.
He said this when met after inspecting an enforcement personnel roadblock at Jalan Hamzah near Kota Baru today. In another development, SAC Abdullah said Kelantan Police issued 27 compounds for violations related to Standard Operating Procedures SOP during Ops Patuh conducted in the state since Friday. The compounds, totaling about 71,000 ringgit, were issued to premises and factory owners in 5 districts. Now, Malaysia will receive 1 million doses of COVID-19 Pfizer vaccine contributed by the United States on Monday. Foreign Minister Datuk Seri Hishamuddin Tun Hussein said these vaccines will greatly help intensify Malaysia's vaccination process and make meaningful progress to the ongoing rollout of Malaysia's national COVID-19 immunization program. The Foreign Minister said Malaysia is also highly appreciative of the support extended by the US through its embassy in Kuala Lumpur since the start of the pandemic last year, including the in-kind contribution of medical supplies, personal protective equipment (PPE), and ICT equipment worth $250,000. He also hoped that the close and friendly ties will be further strengthened for the mutual benefit of both countries. Datuk Seri Hishamuddin said, in the common pursuit for equitable global access to the COVID-19 vaccines, Malaysia stands ready to establish all-round cooperation with the United States in vaccine research, development and distribution. Perak is scheduled to receive 688,000 doses of COVID-19 vaccines in July. According to Perak Menteri Besar Datuk Sarani Mohamad, 147,000 doses are expected to arrive next week. He said if everything goes to schedule, Perak is expected to record a daily vaccination rate of between 25,000 and 30,000 doses.
Kadar itu mampu dicapai memandangkan Perak kini mempunyai 80 fasilitis pusat pemberian vaksin atau PPV, ya, yang meliputi 31 PPV awam dan selebihnya adalah merupakan PPV swasta dan juga klinik-klinik swasta, termasuk program outreach, mobile outreach yang kita buat.
He said this in a press conference after visiting a mobile vaccination program at the Kampung Chada Orang Asli village in Hulu Kinta today. Datuk Sarani said the vaccination program in the state has shown good progress with the increasing number of daily injections. On Perak being placed under the Phase 2 of the National Recovery Plan starting tomorrow, Datuk Sarani said the state has met all the targeted threshold values as set by the government. He said the faster more people get vaccinated, with the state having fewer cases, the sooner Perak can go to the 3rd phase. Pulau Penang is confident of moving into Phase 2 of the National Recovery Plan, PPN, by next week, when 10% of its population are fully vaccinated. Chief Minister Chow Kon Yeow in a statement today said that as of yesterday, 9.9% of the adult population in the state had received 2 doses of the COVID-19 vaccine, and it expects to reach the 10% target tomorrow. He said with this achievement, the state government hopes the National Security Council will consider for Pulau Penang to move to Phase 2 of the PPN soon. The federal government has set 10% of adult population to get fully vaccinated as one of the threshold values for transitioning into Phase 2. Yesterday, Senior Minister Security Cluster Datuk Seri Semasa announced that Kelantan, Terengganu, Pahang, Perak and Perlis would move to Phase 2 tomorrow. Chow said Pulau Penang would be seeing better days ahead as it would receive 591,523 doses of vaccines under the National COVID-19 Immunization Program this month and in August. He added the state's next objective is to see the 60 and above age group completing the vaccination process as soon as possible before they can move on to those below 60 years old later this month. Priority for COVID-19 immunization must be given to trade, distribution and retail industry players due to their importance as the country's economic engine, as well as the risk faced by the workforce that constantly interacts with consumers. Domestic Trade and Consumer Affairs KPDN HEP Minister Datuk Seri Alexander Nantalinggi said the workforce face a very serious risk of infection each day, and this could hamper the success of the National Recovery Plan, PPN. Dr. Sri Alexander added, these sectors should be given due attention in the implementation of the National COVID-19 Immunization Program, PICK, just like those in other sectors like manufacturing and construction. Based on the Ministry of Health MOH data and statistics, only 0.8% of the overall clusters involve the domestic trade sector, and the level of compliance with the Standard Operating Procedure, SOP, in the sector was about 98.54%. The minister said the retail sector, as one of the essential services, operates daily throughout the Phase 1 of the PPN so as to ensure the public could get their supply of food and drink as usual. Dr. Sri Alexander said the government should pay serious attention as the domestic trade sector also plays an important role in driving the country's economy, thus ensuring the well-being of the B40 and M40 groups is protected. A quick break, but when we come back, 72 immigrants nabbed for various offences. Stay with us. This is News at 10. Now, Prime Minister Tan Sri Muhyiddin Yassin is currently receiving treatment for an infection in his digestive system, and there is no evidence to show that his old tumour problem had acted up again. In a press release today, the Prime Minister's office said Tan Sri Muhyiddin, who was admitted to hospital on 30th of June, is still being treated for the infection. On the advice of doctors, the Premier is now in hospital to continue with his intravenous antibiotic treatment. His condition is stable and improving, and he is now allowed to work while undergoing treatment. The statement read that Tan Sri Muhyiddin is expected to be discharged from hospital in a few days' time, adding that the Premier has conveyed his gratitude to those who have prayed for his health and well-being. Chief Secretary to the Government Tan Sri Muhammad Zuki Ali Suri issued guidelines on the approach to be used for the hybrid operation of government offices involving attendance at the office and working from home (WFH) in 5 states, which will enter Phase 2 of movement control under the National Recovery Plan (PPN) tomorrow. He said the hybrid operation would see a 40% attendance at the office excluding frontline services, with the remaining 60% to work from home on rotation basis. He said all meetings and discussions are to be conducted online through a safe medium with guaranteed confidentiality. Tan Sri Muhammad Zuki said this in a release statement today. Yesterday, Senior Minister for Security, Datuk Sri Ismail Sabri Yaakob, announced the transition to Phase 2 of the PPN for Perlis, Kelantan, Perak, Pahang and Terengganu based on the threshold value achieved by the state's consent. Tan Sri Muhammad Zuki said attendance at the office must be accompanied by official document and work pass, apart from complying with the standard operating procedures SOP to prevent the spread of COVID-19 set by the National Security Council and the Ministry of Health. Now, a total of 72 foreigners were arrested in an operation jointly conducted by the Immigration Department and Police, dubbed the Op Patuh in Pudu yesterday. Immigration Director General Dato' Khairul Zaimi Daud said they raided a building at 5 p.m. and checked 245 individuals, 72 of whom were found to have committed various immigration offences, including not having valid travel documents. He said those arrested comprised 43 men and 29 women aged 25 to 50 and of different nationalities. In a release statement today, Dato' Khairul Zaimi said the building believed to be a prostitution den was in squalid conditions, with the lifts and corridor and staircase lights not working properly. He said enforcement officers had to break down doors and most of the occupants refused to cooperate and hid inside the houses with the lights switched off. He added some of the immigrants hid in spaces created out of renovated walls and tried to flee, but failed. Dato' Khairul Zaimi said all those arrested had been taken to the Bukit Jalil Immigration Depot after undergoing COVID-19 tests. They are being investigated under the Immigration Act 1959/63, Passport Act 1966, and Immigration Regulations 1963. Now, 2 men, including a policeman with the rank of sergeant, were killed in a crash involving 2 motorcycles in Padang Kala at Jalan Kota Baru, Kuala Terengganu at 1 p.m. today. The victims, who were identified as Sergeant Zulkifli Abdul Rahman, 58, and Muhammad Muslimin Matsin, 52, died at the scene. Deputy Police Chief SAC Abdullah Muhammad Pia said the accident happened after a motorcycle ridden by Muhammad Muslimin suddenly made a U-turn. The action caused a collision with Sergeant Zulkifli's vehicle, who failed to avoid the motorcycle. The sergeant had just finished his shift at the Pasir Mas District Police Headquarters and was on his way home. Both victims suffered serious injuries in the face, chest and other parts of the body. The bodies were sent to the University Science Malaysia Hospital, HUSM, in Kota Baru, and the case is being investigated under Section 41, Subsection 1 of the Road Transport Act 1987. And that concludes tonight's news at 10. Headlining today's bulletin, prompt response implemented to address high hospital referral rate. Tune in for more updates tomorrow. Till then, I'm Brendan Paul. Stay tuned to Saluran Berita RTM. Stay safe and good night.